Hello, I'm Urologist Dr. Valeria Mendoza, and today I want to speak to you with the greatest clarity and closeness possible about a topic many men over 60 live with in silence. An issue that sometimes triggers shame and fear and is rarely discussed, not even with one's closest partner. Today I want to ask you a direct question. What would you feel if you reached climax with all the intensity of orgasm but didn't see a single drop of semen come out? Perhaps it happened to you once and left you thoughtful. Or maybe it occurs often and you've chosen to keep quiet. Whatever your situation, I understand. In my clinic, I've received men who arrive with a restless look, unsure how to explain it. Some barely whisper it, as if confessing an embarrassing secret. Others admit they've even avoided intimacy for fear their partner will notice. That emotional burden is as real as the physical changes. That's why today I invite you to lift the veil of taboo, because what happens in intimacy is not trivial. It's part of your overall health, your confidence, and your quality of life. And I'll tell you something essential. This does not mean you've lost your virility or that your masculinity is at risk. What you're experiencing is a signal from your body, a message that needs to be understood, and that, in most cases, can be treated. Stay with me, because in the next few minutes we'll go through the causes, the warning signs, and above all, the solutions that science offers today. 1. Understanding normal ejaculation. Before analyzing what happens when semen doesn't appear, it's worth recalling how a normal ejaculation works. Imagine that inside your body there's a small orchestra perfectly coordinated. Each instrument has an essential role, and all must play at once for the melody to be complete. Under usual circumstances, the testicles produce sperm. The seminal vesicles provide most of the fluid, rich in nutrients and energy. The prostate, meanwhile, adds a special fluid that protects and helps transport the sperm. All of this comes together in the urethra, like musicians waiting behind the curtain. When arousal peaks, the muscles of the reproductive system go into action. They contract rhythmically and forcefully, propelling semen outward. It's a fast, almost automatic process, but the result of exquisite coordination between nerves and muscles. Here's a key point. Orgasm and ejaculation, though they usually occur together, are not exactly the same. Orgasm is the neurological response of pleasure and release. Ejaculation is the physical act of expelling semen. Most men experience them as a single event, but in reality, they are two distinct mechanisms that accompany each other. When both occur, the feeling is complete: pleasure, relaxation, and the visible evidence of semen. And that's precisely the key to what we'll explore. What happens when that fluid doesn't appear even though the sensation is present? What is dry ejaculation? Dry ejaculation is a condition in which a man reaches climax, feels the characteristic pleasure of orgasm, but does not observe semen coming out, or notices it in a minimal, almost symbolic amount. At first glance, it seems the body completed the process, because the intensity of pleasure remains. However, something that's long been considered inseparable is missing: the seminal fluid. That difference, though it may seem small, is what causes the greatest confusion. Many men tell me during visits, "Doctor, I felt the same as always, but it was as if the orgasm were empty." That perception feeds worry and, in some cases, the shame of speaking about it. It's essential to understand that orgasm is a neurological phenomenon governed by the brain and the nerves that transmit the pleasure signal. Ejaculation, by contrast, is a mechanical act, muscular and glandular. Ducts contract, valves open, and semen is expelled. They generally occur together, but they're not the same. When the first happens without the second, that bewildering confusion appears. Is my virility failing? Have I lost my masculinity? The answer is no. Dry ejaculation doesn't mean desire or the capacity for pleasure has disappeared. It simply means the body has changed part of its usual functioning. This phenomenon has multiple causes, some temporary and others permanent. It may be related to medical procedures, medications, hormonal changes, or even diseases that affect the nervous system or the prostate. The important thing is to understand that behind each case, there is an explanation, and often, also a solution. Main causes. 1. Retrograde ejaculation. Among the causes explaining dry ejaculation, one of the most frequent is retrograde ejaculation. To understand it, imagine a gate that should close firmly at the bladder neck during orgasm. When it works well, that gate blocks the passage into the bladder and directs semen outward. But if the gate remains open, semen takes the easier path. It goes back into the bladder instead of exiting through the penis. The result is simple to describe. The man feels orgasm, but doesn't see semen. He often discovers what's happening by noticing that his urine is cloudier after sex, because seminal fluid has mixed with it. Causes are varied. One of the most common is surgery on the prostate or bladder, such as transurethral resection or laser procedures. These interventions save lives and improve urinary quality, but sometimes they alter the coordination of nerves and muscles at the bladder neck. Certain medications, for hypertension, some antidepressants, and drugs used for prostatic hyperplasia, also relax the area unintentionally, allowing semen to flow backward. Neurologic damage plays an important role as well. Poorly controlled diabetes, multiple sclerosis, or spinal cord injuries interrupt the signals that should close the bladder gate. I recall the case of Jorge, 58. After laser prostate surgery, he arrived distressed. "Doctor, my orgasms feel empty." When I explained it was retrograde ejaculation, irreversible in his case, but that it didn't affect his potency or desire, he sighed with relief. He realized his virility was intact, only the route of the semen had changed. Diagnosis is relatively straightforward. A urinalysis performed right after climax can detect sperm in the sample. As for fertility, it's true that retrograde ejaculation prevents natural conception. However, assisted reproduction techniques can recover sperm from the urine or directly from the testicles. And for men not seeking children, intimate life remains pleasurable and complete. The lesson is clear. Retrograde ejaculation doesn't mean a loss of masculinity. It's a physiological change that requires diagnosis, understanding, and in some cases, treatment adjustments. Main causes: 2. Obstruction of the seminal vesicles. Another important cause of dry ejaculation, less known than retrograde but just as relevant, is obstruction of the seminal vesicles. These glands, located behind the bladder, produce 60 to 70% of total semen volume. Their secretion contains fructose and other nutrients that feed sperm and give them energy for reproduction. When the vesicles are partially or totally blocked, semen drops sharply or even disappears, even though orgasm remains. It's as if the highway the fluid should travel were closed. The pleasure is there, but the path of semen is interrupted. Causes of this obstruction vary. Old infections, like prostatitis or urinary infections, that left internal scarring. Seminal calculi, small stones that block the ejaculatory ducts. Congenital cysts in the vesicles or deferent ducts, silent for years and showing up in adulthood, as well as pelvic trauma or prior surgeries that narrow semen's passage. Symptoms guide diagnosis. Some men feel an incomplete orgasm or deep pelvic pain. Others report persistent groin discomfort. Some notice thicker semen, lower volume, or small clots. Sometimes the only sign is unexplained infertility. I remember Fernando, 34, who came with his wife after 3 years trying to conceive. He had normal erections and good desire, but noticed his semen grew increasingly scant. A transrectal ultrasound revealed a cyst in a seminal vesicle. With endoscopic surgery, we removed it, and months later his wife became pregnant. Diagnosis requires specialized tests. Transrectal ultrasound to evaluate the vesicle's shape and size, a semen analysis showing low volume or absence of fructose, and, in complex cases, pelvic MRI. Treatments vary by cause. Antibiotics and anti-inflammatories if infection is the origin, endoscopic surgery to remove stones or open blocked ducts, or ultrasound-guided aspiration for large cysts. Recovery is usually quick and with excellent outcomes. In short, obstruction of the seminal vesicles is a silent but treatable cause of dry ejaculation. Identifying it in time allows recovery of both sexual function and fertility. Main causes: 3. Hormonal factors. The third major cause is related to hormonal balance, especially testosterone levels. This hormone, produced mainly in the testicles, drives sperm production and the functioning of the prostate and seminal vesicles. It also boosts sexual desire, enhances sensation during intimacy, and participates in the muscle contractions responsible for ejaculation. When testosterone drops significantly, the system begins to falter. At first, a man may notice less semen volume or that it becomes clearer and more watery. Over time, other signals arise. Decreased desire, less firm erections, less intense orgasms, and even dry ones. Generally, there may also be chronic fatigue, loss of muscle mass, and mood changes. It's important to remember that aging by itself doesn't equal total loss of vitality. In many cases, there is hypogonadism, a hormonal deficiency that needs medical attention. It can be primary, the testicles don't respond properly, or secondary, the problem is in the brain, the pituitary or hypothalamus, which fails to send the right signals. Diagnosis is based on a complete hormonal panel, total and free testosterone, LH, FSH, prolactin, and thyroid hormones. A low testosterone value, especially with symptoms, indicates a disorder that should be treated. Treatment depends on the cause. Testosterone replacement therapy, injectables, gels, or patches, improves energy, libido, and semen production. However, it's not ideal if one wants children, since it can reduce fertility. In those cases, there are alternatives that stimulate the body's natural production of testosterone and sperm. In short, hormonal decline is not a mere detail of age, but a signal that deserves attention. Restoring balance can mean restoring energy, desire, and a full sexual life. Warning signs and associated serious diseases. So far, we've seen causes that, though concerning, often have a solution. However, dry ejaculation can also be a warning of something more serious, a symptom that shouldn't be ignored when it appears with other signs. First, think of urologic cancers. Prostate cancer, as it grows, can obstruct the ejaculatory ducts, causing orgasms without semen or with blood. In advanced stages, it causes pain on ejaculation and increasingly intense urinary symptoms. Bladder cancer alters semen outflow when it invades the bladder neck or the urethra, and it's often accompanied by hematuria. Testicular tumors can also present as infertility and absence of seminal fluid. Another category is neurological diseases. Poorly controlled diabetes is the most common cause of nerve damage in the reproductive system. So are multiple sclerosis, Parkinson's, spinal cord injuries, or strokes, which interrupt the signal between brain and sexual organs, causing dry or incomplete orgasms. There are also less common autoimmune and systemic diseases that matter all the same. Lupus can inflame the vessels that nourish the prostate and vesicles. Scleroderma hardens internal tissues, blocking ducts, and archidrosis can form granulomas that interrupt seminal flow. When to see a urologist immediately? If dry ejaculation appears suddenly, if it's accompanied by pain, blood in urine or semen, genital numbness, leg weakness, or persistent fever. All of these are warning signs of a serious problem that can't wait. In conclusion, although dry ejaculation is often benign, there are situations in which it becomes a crucial alert. Listening to your body and seeking care in time can make the difference, not only for your intimate life, but also for your overall health. 3. Emotional consequences and quality of life. Beyond the physical, dry ejaculation has a deep impact on self-esteem and the emotional life of older men. Many feel they've lost some masculinity, or that their sexual performance is no longer the same, which generates anxiety, frustration, and in some cases, avoidance of intimacy. It's common to hear stories of men who distance themselves from their partners and avoid closeness for fear of judgment or not feeling complete. The emotional burden can be as heavy as the physical symptoms themselves. Shame and guilt reinforce a negative cycle that affects confidence and quality of life. However, it's key to understand that not all is lost. The absence of semen doesn't equal a loss of desire, pleasure, or the ability to enjoy intimate contact. Many men maintain normal erections, intense orgasms, and a satisfying sex life. The first step is recognizing this is a physiological change, not a personal failure or punishment of aging. Understanding the cause and seeking medical help allows you to regain calm, confidence, and emotional connection with your partner. Accepting and addressing the situation openly improves not only sexual health, but also self-esteem, confidence, and overall quality of life. Practical tips from Dr. Valeria Mendoza. Living with dry ejaculation can be challenging, but there are practical strategies to manage it and maintain confidence in intimacy. Never ignore sudden changes in your body. An abrupt onset of dry ejaculation or associated symptoms, pain, blood, decreased desire, requires immediate consultation with a urologist. Manage chronic conditions like diabetes and hypertension. They directly influence sexual function and the neural coordination needed for ejaculation. Keep a healthy lifestyle. Regular exercise, a balanced diet, and good sleep strengthen vascular and muscular health. Break the silence. Talking with your partner and a specialist not only clarifies doubts, it also reduces anxiety and improves intimacy. Understand that dry ejaculation is a physiological change, not a personal failure. That helps restore emotional calm. Follow medical guidance and attend regular checkups. These allow treatment adjustments, improved sexual function, and, when necessary, exploration of assisted fertility techniques. The combination of early diagnosis, healthy habits, and open communication is the best strategy to maintain a satisfying intimate life and preserve masculinity without guilt or fear. In summary, dry ejaculation is not a sentence of lost masculinity nor the end of sexual life. It's a signal from the body that deserves attention, understanding, and, in many cases, treatment. Understanding its causes, surgical, hormonal, obstructive, or neurological, is the first step toward regaining calm and confidence. I've seen men who, after a clear diagnosis and medical guidance, regain self-assurance and enjoy intimacy without fear or shame. Cases like Jorge, Fernando, or Cayetano show that although the path may require adjustments or interventions, vitality and pleasure remain possible. Listening to the body, attending regular checkups, and maintaining healthy habits, exercise, balanced nutrition, sleep, and management of chronic diseases reinforce not only sexual function, but also overall health and self-esteem. Don't let silence or resignation dictate your intimate life. Speaking up, getting informed, and acting in time can transform the experience, restoring confidence, well-being, and emotional connection with your partner. If this information has been helpful, leave your comments, share your experience, and remember that consulting a specialist and understanding what's happening in your body always opens the door to solutions and hope. Your masculinity and intimate life can remain full and satisfying, even in the face of dry ejaculation.